Hi, welcome back to Future Path. And once again, we have Dr. Shikha with us. And for those of you who are here for the first time, I sincerely urge you, please look up two parts of the conversation we have had. And the first part is where she talks about her journey, and second part is very interesting, largely talking about public health in the Indian context. So please do go catch up on that and now enjoy the future conversation. And once again, Ika, welcome back to Future Path.
Thank you.
And thank you so much for making time. So let's jump in straight and hear what's your take on the future.
So, as usual, I'm ready for the ride. Future is always positive, Nanjuda. And with regards to public health, I would say we need more and more point of care devices so that people can access health services closer to where they stay. They don't have to run to some centralized facility, or they don't need fancy diagnostic equipment. They need simple tests which can tell them, rule out or rule in the presence or absence of a disease. Very simple. And here our Startup India initiatives are really contributing, because a lot of entrepreneurs, a lot of startups are coming with such rapid diagnostic technologies. And also, there are a lot of medical device manufacturers that have also felt the need of these point of care technologies. So, as a microbiologist, my future fast vision is to make healthcare accessible where people stay. Because, when we talk about the geography, the length and breadth of the country, there are difficult terrains. There are mountainous region, there are deserts, and there are rivers. So, our public health system is very beautiful. Northeast, they've used the Indian Army to deliver healthcare in their helicopters. We have seen it. In Kerala, in Lakshadweep, they have used boats as units to dispense healthcare. Also in Assam. So, these are the future fast things. They need to spread across the length and breadth and geography of the country, make healthcare accessible to all.
Yeah, and also now we are the populous uh,
Yes.
country in the world. So
Yes. And another vision is salutogenesis. We need to talk about not only what to do after a disease has manifested. If you're talking about infectious disease, yes. So then diagnostic stewardship and antibiotic stewardship. So getting the right diagnosis, treating it with the right antibiotics, following the government guidelines and protocols, which every healthcare system establishment is endeavoring to follow. Because, COVID, we all survived, or most of us did. We don't want to sit on a pandemic that is fueled because of lack of antibiotics to treat them, because microbes are getting smarter and smarter. The biggest threat would be a super bug, which is a fungus or which is a yeast. Virus don't survive outside the host. A, a yeast is like a smaller eukaryote.
there were some
Antibiotics,
conversations about a superbug
yes,
is just around the corner. We could
yes,
be in for another pandemic very soon and all that.
yes,
You
yes.
you think so?
So, the thing is, because we are overprescribing antibiotics, we all pop up an antibiotic just for a common cold or a sore throat. So we are abusing antibiotics. So, a day will come, and in hospitals,
No,
superbugs are
but the
developing.
day will come. People are saying is just very near. Do you agree with that?
Yes, because we are exhausting antibiotics and microbes are becoming resistant. A yeast you will need to treat with how you treat a human body. So, that is also the thing. If a bigger parasite goes out of hand, becomes a super bug, they'll be more difficult to treat. So, let's use these chemical agents cautiously. Prevention is the key. Hand hygiene, basic amenities. We can evade a lot of things which can go out of proportion. Let me ask you a question. Hand hygiene was advocated so much during pandemic. Now, how many of us are still following it? That is the question. We need to continue the good things we learned and acquired.
Mm.
So, averting future pandemics, uh, building a safe environment for all of us to thrive. Survival is a necessary, but
So,
we
in
all
your
need to
view,
thrive.
when do you think we will be hit with another pandemic?
The way
Months, years?
hospitals, the way hospitals are reporting superbugs, they are there. So,
So, how
this
close or far are we from a pandemic then?
So, if we don't adopt diagnostic stewardship and antibiotic stewardship, it's just right the corner and it's going to affect all of us.
So, how far or close are we? I mean, I'm just trying to push you to make a timeline saying, okay, 2025 or November
There,
24 or
it is
27.
already there. Superbugs are already there, and let's not fuel them. The problem is it's in our food, it's in our environment, it's in our health system. Antibiotics are everywhere. So, it's in the food, it's in the plant products also to prevent infections, right? It's in the poultry, in the eggs, it's everywhere, it's in the environment. So, it's coming in discharges from the hospitals. It's there in the community settings as reservoirs. So, that stewardship needs to come in. It's about the future fast to save a pandemic, which we have already embarked upon. I won't say there's a timeline, we are already into it. It's just not blowing out of proportion, and it can catch us any day if we don't take remedial now. It is getting reported, it's killing people everywhere. It's getting reported. If you look at the reports, Staphylococcus aureus, drug resistant, is taking a toll. People are dying of sepsis. So that's a bacteria in the bloodstream.
You're saying in India?
Yes, lots of it getting reported, and survival rate is only 30%.
Wow.
So the rest are
Where
not.
where is this getting reported? Which part of India?
These are published reports.
No, I'm asking which part of India.
So there are more authentic reports from US hospitals coming up.
Okay.
India is catching up to report. We have a very good network of laboratories which are doing these diagnostics. So we also have these reports available with us. Indian Council of Medical Research is working for it. Hospitals and these laboratories are reporting the prevalence of superbugs in our hospital settings, in our community settings. So there's a list on the ICMR website reported through these regional laboratories, which we can access to see. So, we are there. We are there. It's like when it hits you. So, the day somebody lands in a hospital, you will go for something, but you will end up getting treated for something else in addition. That has become the norm.
Yeah.
So want to prevent such a future because we are already into it. So, getting the right diagnosis, taking the right antibiotics that work. Over-the-counter prescription of antibiotics need to stop. Government of India has a red line for these antibiotics, which can only be given by prescription, we all
Okay.
need to know these antibiotics are Schedule H drugs available on prescription.
No, but won't the pharmacies get penalized if they are selling without prescription?
They have to maintain a record
Oh,
of the Schedule H drug they are selling.
so there's no way people can just pick it up, right? If they're sold only against the.
But we go to our chemist only, no? We think they will give us a diagnosis for a sore throat. We did
Oh,
not,
so no,
yeah,
but
so
even if they
over the
do,
counter,
but they are required to submit prescriptions, right?
they do,
There is a system. There should be a.
they do.
Oh, so you say they even fabricate the prescription and do this?
No, I'm not talking about fabrication. But the thing is, over the counter prescription of antibiotics should stop. And
Oh, okay. Overall, it should
yes,
stop.
yes, because
Not
they
just
have
the ones you said which are marked with red.
the red lines are the one dangerous ones. They have a threat for
So
developing
they are anyway
resistance.
mandatorily only against
Yes,
prescription.
yes. But otherwise,
But what
also
you're saying is that we should have anything, uh, any
antibiotics.
antibiotic should be made strictly against
Yes,
prescription.
it should show a doctor's prescription with the
So do you
confirmatory
think it's a
microbe.
possibility here in India anytime sooner in future?
That is what the health system needs to gear future fast. A diagnostic stewardship, because the doctors need to know what they are treating and what antibiotics that microbe needs to be cured, because for viral infections you don't need antibiotics. So now there are multiplex panels also. In one machine you can run a lot of tests. In one kit you can find a lot of diagnosis. There are also panels, something like a lower respiratory tract infection, something like a bone infection. A lot of things are there. That's called diagnostic stewardship. Before prescribing an antibiotic, to know what are we treating for. That is very important. When I say having point of care diagnostic closer to people where they stay, so at that point, also it is essential to know the resistance profile, because each human could be different. Each disease they could have acquired, or the pathogen can have different susceptibility to the drug. So let's treat them well in the first go when they've come to get a diagnosis. That is the need. Future fast.
Right. So if you were to make predictions, what would you choose to make predictions on?
A world free of diseases and full of hope.
And that statement is full of hope with yours.
Yes. Only hope survives when there is nothing. As a human population, we are full of hope. Hope survives everything.
Oh, well, uh, for a qualified researcher, scientist, microbiologist, and uh, in sense, healthcare system professional, won't can't be talking only hope, right? So
So
you got to talk about process. You got to talk about
okay.
policy.
So no philosophy. You want science. So then more investments into research and development, more investments into
But do you see
infrastructure.
that happening? Do you see that happening?
Yes, more medical
Even
colleges.
investment on infrastructure is happening.
Yes, a lot
Okay.
of AIMS government hospitals are coming up across the country. Strength of medical colleges are improving. More medical colleges are coming up. So we need to strengthen the health system, like you said, the doctor to patient
Do you
and
do, yeah? Do you see uh, how it is the integrated medicine approach in the West, right?
Mhm.
And also in India, but there is a lot of resistance also, right, for Ayurvedic and other systems. There is some element of resistance also. But do you see this integrated healthcare approach will evolve further?
Integrated health approach, precision medicine is the key. So the thing
No,
is,
when I say integrated, integrated with allopathy with Ayurvedic and others, the Ayush
so
integration of this multi
let me ask you
disciplinary.
something. Let me ask you something. If we have a common cold, don't we jump for a ginger tea first?
No, at a home front, but in a systematic way, do you see that getting better, better
I
than?
I don't see that happening because it's because of people also. Because I've seen people who say very strongly homeopathy works for them, and there are certain people who say very strongly homeopathy doesn't work for them because every individual
No,
is
but
unique.
Ayush is trying to facilitate this integrated medicine approach,
So
right? By
so
trying
so
to.
so if you're saying these Ayush doctors can be appointed to fill up the vacancy gap in for a medical MBBS background doctor.
No,
So
they have separate hospitals anyway, so it's not. But the focus on this, do you think will create a better balance in our healthcare approach?
if we stop looking down them as compared to allopathy, yes. But I don't see that day happening.
Oh, you don't see that happening in future?
My personal view and totally personally mine, I have not seen that happening. I don't see it happening because allopathy will be allopathy, Ayush will be Ayush, homeopathy will be they'll
I
never.
mean, Ayush has
Yes,
homeopathy also part of
yes,
Ayush.
yes, Ayurvedic.
Ayurvedic, homeopathy, and few other things, right?
I don't see them merging somehow. My views are totally personal.
Okay. No, I mean, of course, it is your views that I'm asking, but you don't see it happening at all. Okay. Right.
Yes.
And uh, but Ayurvedic seats, medical seats are also getting filled up more consistently.
So
So
that's why I
where do
said
you?
to fill the gap, the manpower gap.
Oh, is that the approach government is thinking
The
that this will
yes,
fill that?
yes, that could be done.
But will it meet the need?
That is what they're trying to plug in the gap.
No, I'm asking you, will it meet the need?
Yeah, because they have the basic knowledge, and
So
with
it
years
can?
of practice, they'll add to the experience.
Mhm.
It's something like having something as compared to no doctor in a facility. It would help.
Yeah. Another thing is, see, doing an MBBS is so ridiculously expensive, right? So, and doesn't look like anything seems to be done. I don't know with the building of new medical colleges, is that thing really addressed?
Sorry, I didn't get the question. I mean,
See, doing a medicine is very expensive.
okay.
At least from what I hear from people telling me. Uh, uh, I think some friend was telling that doing an MBBS is nearly a
Paid
50 lakh
seats.
affair.
You're saying a paid seat.
See, honestly, majority have to go for paid seat. That's the whole fight about need, right? So majority will end up going to a paid seat. There'll be only a small percentile of people who actually get to pay a very less government aided fees. So majority will end up paying a fortune. So if somebody is paying 50 lakhs to do MBBS, uh, uh, where will they work? Where will they earn that kind of money?
They have to set up private practice.
So what will happen to public health system?
That problem is for the government to solve according to
No,
them.
I'm asking you because you work with government, you work in it. So your perspective, what do you see in this context? Where do you see this
So
going?
they have these compulsory rural internship. They have to go and serve in the village compulsorily. They get an
Uh,
exposure,
yeah, I was speaking to
earning money.
I was speaking to a filmmaker. who's actually written a film script in this particular context. Apparently, uh, the the medical student who have to do this service are refusing to go. So apparently, there is part of the system itself is that you can actually pay a fine.
Oh,
You can pay a fine for having refused to do the rural service. So you
okay.
pay, so you actually can avoid. But if that is the system, if somebody pays, then somebody who can't afford to pay is mandated to go. So they get a convenient uh, allocation of where they can do their service. So, given that, of course, his story was about how no everybody refuses. So, the government system apparently the system has this provision that they work with the development sector and they tap into the development sector to facilitate a doctor to be allocated here because the medical system is not able to enforce. I mean, the system itself gives the provision that they pay and get out of it. So the development sector brings in somebody who's personally motivated, like what you were saying earlier in the conversation, that brings in somebody who's personally motivated to put in there, and they are not the medical. So, so I mean, that's a film story, but he says that this is his research story. This is the reality. So,
Okay.
so of course, that movie is not yet made, but I just so the his movie is about how this whole thing. He's obviously putting that whole thing in a nice story and also an element of drama, comedy, and all that. But he wants to communicate this message
Okay.
through that movie. But he says this is a researched plot. I mean, he saw and he says it is so serious, but this is what it is.
Wow. Wow. Would love to watch this movie when it is out.
No, but where do you see this changing, or do you see this changing, this scenario changing at all?
See, I
Or,
have,
what would you advise the public health system how to address this then? I mean,
the
what's kind of
parents are ambitious. So they want the kids to take up medicine. I have seen that personally. So it's children who are fulfilling their parents' wishes. It's a cadre of no-touch doctors. So they don't even touch the patient to find out the ailment. So this is happening. So they are not, if I may say bluntly, who are avoiding rural internship, they are not meant to work in the public system. They are best suited to open up their private shop or work with a uh, reputed health establishment. That's all I
like
want to
what
add.
they call a corporate hospital?
Yes. So, they have to take back what they invested. So there are ways to do that. But people in public service are there because of the passion. They are into it, knowing the hardships. They want to give back to the society. And, if I may, there is Maslow's it's about needs, what fulfills us. So if your basic housing, food, recognition, fame, these needs are fulfilled, then only you can give back to the society. So it is where you are stuck. And at a particular
So what you're saying
time
is the
comes.
public healthcare system's responsibility, or it becomes their responsibility to make sure that they are able to provide with all these things to the doctors so that they go and do the rural service willingly because all these things are met.
A better pay, better infrastructure, some basic amenities will really help. Because health is always about caregiver, care seeker, and the entire cascade which works around it. So, if he doesn't have electricity, how will he work? I mean, if in a laboratory they want to do a test, if there is no electricity in a rural area,
At least the recent claim I came across is 95% of villages have been electrified, right?
Yes, yes. But there are a lot of power cuts still happening. So if they have generators, the problem in public health which we come across is they won't have money to buy the fuel. If they
Uh,
have the money to buy the fuel, then in public health you
what
come
about
across.
governments invested in so much of the solar power and all that, right? What happened to that? They are not in this public infrastructure.
No, that's coming up in a big way. Solarification, lot of thing is happening, lot of government subsidy is going into it. In fact, our NGO is also trying to implement localization of SDGs in villages. So yes, a lot
So
of.
this is part of that, is it?
Yes. So, to actually provide basic electricity, to run basic facilities, and to do basic agricultural work. Because, everything requires electricity. So, that's the mandate. And they are very successful models. In fact, very interesting thing, it affects the livelihoods also. So, very important case study I read. I'm quoting because I read, it came in my purview. I'm sure there are lots of them out there. Heirlooms in Banaras making silk sarees is running on solar plants. So, there's a livelihood angle also to it.
Mm.
So, a lot of exciting things happening. A lot of things lot of learnings that can be introduced. So, in a government health program, we always also say we have to learn from learnings of the other successful health initiatives. So, a lot of cross synergy, a lot of peer learning is happening and should be accelerated more future fast.
Right. Wonderful. Thank you. You actually said more times future past than I ever did. So really I appreciate that. So, any other uh, before we conclude this, do you have some prediction to watch out for, look out with? I mean, positive or negative? Do you have anything that one should look out for?
This is something generic, not
Hmm.
philosophical, not
Yep.
scientific, but this is something which is very close to my heart. We need to invest in educating and making good future citizens.
What's that?
Our
What is a good
children,
future?
our children, they are the future of the nation.
Hmm.
We have to invest in educating them. We need to invest in them mentally, socially, in all aspects. They are the future. And our responsibility is to leave a good, healthy planet for them. So we all need to do our bit. So
Right.
the NGO I work with, we are emphasizing a lot into child literacy, women empowerment, rural livelihood, and also campaigning for improving health-seeking behavior and accessing health facilities. So, these have all been my learnings in my life that if you empower people with knowledge, you don't have to give them food, give them employment, give them knowledge. If anybody comes to me seeking a help to a means to earn, my first instinct is give me your CV. I'll see what can be done. So, help people get employed, help people generate employment as entrepreneurs. So, we all cannot be looking for government jobs or working in the corporates. So we need more people who create jobs. So very happy in all the projects and all the endeavors which I do, have been able to improve the economic status of people, have been able to link people for new jobs, I always try to be there for people. Like if they come with a query, come with a question, like we all should be able to let people gain from our expertise. Knowledge
Wonderful.
should be spread.
Wonderful.
Acquire knowledge and spread knowledge. That's my last word.
Right. Thank you so much, and uh, really appreciate it. To the audience and listeners, once again, the links are there right below this podcast. You can follow her work, and she's also very approachable. So, like she mentioned, you know her expertise. You have any questions, you can reach out to her. She will respond, and also, the areas that she is working on. So, if you see there's a way you can collaborate with her, please do reach out to her and share this conversation with all those who you think will benefit out of this. Once again, thank you so much. And thank you so much, Shika, once again.
Thank you for having me on Future Fast. All the best.
Thank you.
Bye bye.